Good morning, everyone. I'm Dr. Attalla, and today we're going to talk about emotional regulation. This topic is important for people who are struggling with anxiety, with depression, with PTSD, borderline personality, basically any psychological problem. Because any psychological problem, there will be some emotional dysregulation or some emotional disturbance. So, in this topic, we're going to talk about how to regulate your emotion. First, I want to start with what is the definition of emotion? What are the feeling? So emotions or feeling are the signals by which your body know what is happening. For example, if you went through a pleasurable event or something good happened, you're going to feel good. If something distressing or painful happened, you're going to feel bad about it. You're going to feel depressed. So basically, the feelings are the signals that tells you what is happening around you. So, but for emotions, there are two types of emotions or two types of feelings. There is primary emotions and secondary emotions. So primary is the emotions that happen immediately when something happens. This is the first interaction between your feeling and the event that is happening. So, for example, if you won a contest and you're gonna feel surprised, you're gonna feel you're gonna feel happy, excited right away. You don't have you don't have time to think about it. If you hear that someone you care about dies, you're going to feel sad, you're going to feel depressed, and this is the immediate reaction or emotional reaction. If someone offends you or something bad happens, you're going to feel angry, you're going to feel mad. This is a primary emotion. But if someone offends you and then you get angry, then after 2 days you start to feeling guilty about it. You start feeling anxious about happened. We call this the secondary emotions. So the primary is the emotions that happen right away. Secondary is the emotions that happen after that. So secondary emotions are the emotional reaction to your primary emotion. And I give you here an example. If you see this guy, his name is Penn. So Penn, what he's doing, he was so angry at his sister because she did something wrong. So he is very angry at her. He's very mad at her. So this is his first reaction, the anger. But 2 days later, he started feeling guilty about it. So that he was so angry at her, and we call this feeling of guilt. This is a secondary emotion. And why we need to know the primary and secondary? Because I see in my clinics there are some patients, they come to see me, they come with lots, because usually the secondary feeling are lots of feelings. It's not just one: depression and anxiety, guilt, worthlessness, anger, and sometimes they come all together. If these feeling, and we expect this is a primary feeling, but no, it is a secondary. We need to dig deeper to know what would that primary feeling, so they will be able to process both the primary and secondary. And the main purpose for this session is you to be able to tell what is your primary and secondary emotion. I'm going to give you a complicated example for what I mean by primary and secondary. So this is Mary. I think she has a presentation at work. She's gonna give a presentation at work, but she was so anxious about it, and I think she has also a social phobia or social anxiety, so she couldn't do the presentation. Okay, so her primary feeling is anxiety. But 2 days later, she started to feel depressed, she started to feel worthless, and she started to feel guilty because she has made such a big deal about it. It was, it is not a big deal. You can present, you can talk, you prepare some PowerPoint slides. But this feeling of guilt, worthlessness, depression is a secondary. The primary is an anxiety about the situation. This patient, if she's continue to have, if she was not able to process her feeling in a healthy way, maybe 1 month or 2 months later, she's gonna come to see me with symptoms of clinical depression that needs a treatment, that needs an antidepressant. But if she was able to cope with her secondary emotion and to identify what is the primary emotions and the primary feeling and to connect with it and to cope with it in a healthy way, which you're gonna learn in these sessions, how to cope with unpleasant feeling in a healthy way. She wouldn't be suffering of depression or anxiety. So primary emotion and secondary emotion, it is important to learn how to cope both of them, to cope with both of them. But the first step to learn how to cope with them is to identify what are the primary and what are the secondary emotions. I want to also talk about emotional dysregulation. Emotional dysregulation is the emotional disturbance. This is people who are not able to cope or regulate their feeling. There are people who are born like this. Also, environmental factors are important. Some people are born emotionally sensitive, emotionally vulnerable, emotionally reactive. If something happened, and you should be reacting emotionally like 2 out of 10, for some people will react 10 out of 10. So this overreaction, we call this emotional dysregulation. Also, those people who have this emotional dysregulation or emotional disturbance, they take longer time to return to baseline. So maybe someone offends you at work. If you don't have the emotional dysregulation, you're gonna feel bad maybe half an hour or an hour, and then you will be able to let it go. Without using any therapeutic technique, it will go. But for people who have this emotional dysregulation, and this is part of an anxiety and depression and the borderline personality and the eating disorder, those people will not be able to let go in an hour or 2 hours, and some people will not be able to let go for a month or 2 months. And the accumulation of all these unpleasant feelings will end up with negative consequences. So let's imagine in Mary's example, this lady who was not able to give a presentation, and she felt anxious, she felt depressed, she felt worthless. If she doesn't have the skills to cope with these feelings, she might end up using alcohol to cope with this feeling, or use any addictive drugs ranging from marijuana to cocaine to crystal meth or whatever, because she is not able to cope with this emotional pain. Some people start cutting when they have this emotional pain, and I get this question all the time: why people do this? Why they cut, or why they punch the wall, or why they do all this self-mutilation things to when they have this emotional pain? Because of 3 things. It is they distract themselves, so they have this emotional pain. They distract themselves with physical pain. This is one reason for doing this. Another reason for doing this is it is some sort of punishment, because most of people with mental health problems, they feel guilt and shame. This is part of the mental health issues. So they think that they deserve punishment, so they punish themselves doing this cutting. And also, when you cut, this release endorphins inside your brain. These endorphins, it's gonna make you feel good, temporary, but it's gonna make you feel good a little bit. So there is some sort of addiction involved in cutting, because it make you, yes, there is physical pain, but sometimes there is a release of dopamine or endorphins inside your brain that make you feel good. The same when you use addictive drug or any addictive behavior like shopping or sports or anything that release endorphins and dopamine. Some people who are not able to cope with emotional pain, they start to engage in binge eating, and we call this emotional eating. They feel bad, then they start eating. And there is people also who don't eat at all. When they feel bad, they don't eat. And if exaggerated form of this non-eating, we call it anorexia or maybe bulimia. Also, some people will be very violent and aggressive when they can't cope with the pain, the emotional pain. That's why I'm telling you, first step to cope with the pain, with emotional pain, first connect with your feeling. Don't repress it. Don't react. Just know it first. Know what it is. Give it a name. Some people also will have somatic symptoms, like physical symptoms. When they are not able to process their feeling in a healthy way, they're going to start complaining about headache, nausea, heart racing, tingling and numbness, dizziness, all these different physical symptoms, which is part of or a consequences of the to the psychological pain. And sometimes the last one is when accumulation of negative feeling or unpleasant feeling that is not processed in a healthy way, it can end up with psychological problem ranging from an anxiety to depression to bipolar. And of course, your genetic and the predisposition, your genes and the predisposition to certain psychological disease will end up with these forms of different disease, from bipolar to schizophrenia to eating disorder, but it is all start with emotional dysregulation. I want to thank you for listening to this session, and I'm going to see you again with part 2. Thank you.